Hello, this is Dr. Eldred Taylor, and I'm here with one of our speakers, Dr. Russell Jaffe, and he will be speaking at our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia, November the 10th through the 12th, 2016. Dr. Russell Jaffe is the CEO and chairman of Perk Integrative Health. He is one of the pioneers of integrative and regenerative medicine. Since inventing the world's first single-step amplified ELISA procedure in 1984, a process for measuring and monitoring all delayed allergies, Dr. Jaffe has continually sought new ways to help speed the transition from our current healthcare system's symptom reactive model to a more functionally integrated, effective, and compassionate system. Perk Integrative Health is the outcome of years of Dr. Jaffe's scientific research. It brings to market 3 decades of rethinking safer, more effective, novel, and proprietary dietary supplements, supplement delivery systems, diagnostic testing, and validation studies. Now, in November, Dr. Jaffe will be speaking on the topic Functional Management of Autoimmune Conditions, Restoring Immune Tolerance. Dr. Jaffe, how are you?
Very well. Better for being with you.
Oh, well,
How
great.
are you, Dr. Taylor?
I'm fine. Uh, what we want to know is what can we expect to hear in November about this topic? What can our prospective attendees anticipate hearing?
Well, for the last 4 decades, it's been my privilege since leaving the National Institutes of Health to bring together a relatively unique perspective. That is, I'm cross-trained in internal medicine and in traditional Chinese medicine. I'm cross-trained in Ayurveda, but also in what we would call mindfulness or meditative practices. I came as a skeptic. I am going to present what I believe is a synthesis, what I believe is an important rethinking of what lab tests to do, how to interpret them, and what to do with that in terms of lifestyle opportunities. Add life to years and years to life by doing a few correct tests, interpreting them to their best outcome goal values, leaving aside statistics and usual or laboratory ranges, and then knowing how to bring people to lower risk, better health in both the short and long run, because we can add decades of quality life in just a few months if people are willing to change a few habits of daily living. But much more importantly for most individuals, their restorative sleep improves, their digestion improves, their mood becomes more stable and improves, their relationships improve, their capacity to deal with problems and challenges and see them as opportunities improves. And that's really what people find most exciting. This is the way I choose to live my life. It is the way my children choose to live their lives. And they have survived their parents, and I will tell stories about them. And my own parents came around, if you will, after I had my epiphany or my insight to changing their habits, and I think improved the last years of their life markedly. So I'm going to share a synthesis of what excites me about the functional integrative health care model, a primary, proactive, personalized prevention approach that is ready for practice.
Okay, Dr. Jaffe, I think I've seen on several of your sites and several of your information that you distribute that you're known to say stop fighting and start healing. What does that mean, and what evidence supports your rethinking of your personal health promotion?
Well, thanks for asking that question, Dr. Taylor, and I'll be presenting it in much more detail. I'll present the evidence and the background in November at the Functional Medicine Association conference, which I'm very pleased to be returning as a speaker. The headline, though, is that we spend too much time trying to get the diagnosis quite right or trying to fit the symptoms together in a way that we treat the symptoms. And I want us to go upstream from that. I want us to look at primary proactive prevention. I want us to look at the nutritional and essential cofactor deficits that predispose people to ill health. I want to look at the toxin load, both mental, physical, and environmental. And where people are resilient, I want them to celebrate. And where they're at risk, I want them to understand what to do today, tomorrow, and next week and next month. And then, and this is a very exciting part of the work, come back in just a few months to see how much progress they have made and celebrate the progress they do make, but also if they're stuck, if they have biochemical individuality, if they have any other particular metabolic or toxicologic issues, they become clearer, and we have predictive self-assessments, predictive biomarker tests that we can interpret today to their best outcome and show people where they are resilient and strong, but also, and importantly, show them where at risk and what to do about it.
You know, when you talk about trying to get the diagnosis correct, that's one of my themes. You know, we have been taught in traditional medicine that you have to wait until there is a disease process and then you can name it. But as you're saying, and this is what we're all about, is that really it's about a system that's not functioning well. It's not at the point of disease. And so a lot of times I think we've made up these diseases like chronic fatigue and attention deficit because they don't really have a disease. They're trying to name a dysfunction. And then when they get that name, a lot of times the patients are sent away like there's no treatment for it. You have chronic fatigue and you're just going to have to live with it. And so I think that's the difference between us that have had that epiphany, is that you don't have to sit around and wait till the symptoms get to the disease point. You can make systems function better if you understand how those systems work and what they need to work correctly. And most of the time they
And
don't,
it's the
and all the times
details,
they don't need drugs. It's not drugs. It's something that the body is missing that it needs.
and yes, indeed, and it's the details, the particulars, making this individual and predictive, evidence-based,
Right.
and cost and outcome effective. It's that I have spent the last 4 decades synthesizing, and that I'll do my best to present in a few minutes to colleagues, and with enough, basically a new toolkit that clinicians can start using, because the 8 predictive biomarker tests are well known, but we've rethought them from a personalized and integrative perspective so that they are best outcome based. And then, what is the lifestyle option? What is the habit of daily living? What is the eat, drink, think, do part of the plan? And that's where we start, what people eat and drink and how they think and operate or move in the world. And very rarely do we need to go beyond that.
Great. Well, Dr. Jaffe, we've had you in the past and you're a wealth of knowledge. That's why we invited you back again. 4 decades of studying this gives you a wealth of knowledge, and we appreciate the fact that you're willing to share it with us at the American Functional Medicine Association. If you have not heard Dr. Jaffe before, you want to make sure that you come and make a point to hear him this year, and that will be in November the 10th through the 12th at the Georgia World Congress Center at our annual meeting. Dr. Jaffe, we appreciate your time to do this interview. We so look forward to seeing you in November, and we appreciate you accepting our invitation to come and share your wealth of knowledge with our group.
It's a privilege to come back. I look forward to seeing your wife, the other Dr. Taylor, November 10th to the 12th. Being together in Atlanta will be a pleasure and a privilege, and I look forward to personally greeting all of the folks who attend the conference and finding out how we can help them speed the transition from the current sick care system to the healthful caring system we all deserve.
Great final words, Dr. Jaffe. All right, and thank you again, and we'll see you in November.